Hello, listeners, and welcome back to Everyday Health Stories, the podcast where we explore the fascinating world of medical science through the power of storytelling. Today, we're taking a deep dive into atrial fibrillation, or AFib. We'll be unpacking the key highlights of the latest diagnosis and management guidelines from renowned heart health experts and organizations. So, get ready to learn a ton.
Absolutely, Anna. I'm super excited to break down these essential guidelines with you all. We'll cover everything from lifestyle tweaks to cutting-edge treatments. It's going to be a really informative episode.
Dr. Reddy, why is it so important for us to talk about atrial fibrillation?
That's a very good question, Anna. AFib is a major public health concern that affects millions of people worldwide. It's the most common type of irregular heartbeat and significantly increases the risk of serious complications like stroke, heart failure, and even dementia. Despite its prevalence, many people don't recognize the symptoms or understand the importance of early diagnosis and proper management. By talking about AFib, we can raise awareness, empower individuals with knowledge, and help prevent life-threatening complications through early intervention and evidence-based care. It's not just about heart health, it's about improving quality of life and saving lives.
That's great, Dr. Reddy. I hope this episode helps a lot of people understand AFib and makes a real difference in their lives. Okay, so let's start with the basics. What lifestyle changes do the guidelines recommend for managing AFib?
Well, the guidelines emphasize comprehensive lifestyle and risk factor modification. They're really important for preventing AFib onset, its progression, and just bad outcomes in general. So first up, exercise. The guidelines totally recommend moderate to vigorous exercise for a whopping 210 minutes per week. A randomized trial actually found that this reduced AFib recurrence at 12 months and even lowered symptom severity. It's great for your heart, right?
Wow, 210 minutes. That's like a serious commitment, but it makes sense, right? Since exercise is good for overall health. So what about diet? Any specific recommendations there?
Oh yes, alcohol. The guidelines say you should minimize or totally eliminate it, especially if you're aiming for a rhythm control strategy. Studies show that it can really reduce AFib burden and recurrence. A 2021 study actually found that people who abstained from alcohol had way longer times to recurrent AFib, 139 days versus just 62. That's huge.
Oh, that is absolutely significant. Just thinking about how much longer people can go without a recurrence by simply cutting out alcohol. That's such a powerful change. So, Dr. Reddy, what other lifestyle adjustments can make a big difference in managing AFib?
Smoking. It's very, very important to quit. It's linked to worse cardiovascular outcomes and death in people with AFib. Plus, if you quit, you're less likely to have a stroke or, die.
Right. Smoking's bad news all around. I'm glad the guidelines emphasize quitting. What about weight? I know that's often a factor in heart health.
Oh, absolutely. Weight loss is essential for AFib patients who are overweight or obese, with a BMI over 27. The goal is at least a 10% weight loss to reduce AFib symptoms, keep it from coming back, and stop it from becoming persistent.
Okay, so we've covered lifestyle, but what about medication? Specifically, what do the guidelines say about reducing stroke risk in AFib patients?
So, stroke is a major risk with AFib, right? And it varies a lot from person to person. The guidelines recommend using a tool called the CHA2DS2 VASC score to evaluate each person's risk. This helps figure out your annual risk of stroke.
Okay, so how does that risk score work, and what are the treatment options?
Well, the CHA2DS2 VASC score is a simple system that looks at factors like age, heart failure, high blood pressure, diabetes, and if you've had a previous stroke or other vascular issues. By adding up these points, it gives an estimate of your annual risk of stroke, helping guide decisions about blood thinners or other treatments. For most folks with a stroke risk of 2% or higher per year, that's, a pretty moderate to high risk. The guidelines strongly recommend anticoagulants to prevent stroke.
Okay, so what are anticoagulants exactly?
So there are two main types: direct oral anticoagulants, or DOACs, and warfarin. The DOACs include drugs like, apixaban, dabigatran, edoxaban, and rivaroxaban. They're generally preferred over warfarin because they're more effective and safer for most folks, and and they're easier to take, right? No constant blood tests.
Oh, that's good to know. So are DOACs right for everyone?
Well, not quite. For folks with moderate to severe mitral stenosis or mechanical heart valves, warfarin's still the go-to drug. A recent study called Invictus actually showed that warfarin worked better than rivaroxaban in patients with rheumatic heart disease and mitral stenosis, and these are often conditions that go along with AFib.
Right, right. What about other options for people who can't take anticoagulants at all?
Yeah, for those at high risk of stroke who, you know, can't take anticoagulation, usually because of bleeding issues, the guidelines suggest considering a percutaneous left atrial appendage occlusion, or more popularly known as the Watchman device. That's like a little device they put in to block off part of your heart where blood clots tend to form.
Oh, wow, interesting. It sounds like managing stroke risk in AFib involves a lot of personalized decision making.
Absolutely. It's crucial for doctors to work closely with their patients, assess their individual risk factors, and consider their preferences when choosing the best strategy.
So, moving on from stroke prevention, what about antiplatelet therapy? Like, what about aspirin? Is that recommended for preventing strokes in AFib?
Okay, so good question. So antiplatelet drugs like aspirin aren't actually recommended as alternatives to anticoagulants for stroke prevention in AFib. A meta-analysis of trials comparing aspirin to apixaban in patients who couldn't take warfarin showed apixaban was better at preventing stroke or embolism with similar rates of major bleeding. And the active W trial, which tested aspirin and clopidogrel against warfarin, was stopped early because warfarin was far superior at preventing strokes. So, unless there's another reason for someone to be on aspirin, like having coronary artery disease or peripheral artery disease, they shouldn't be taking it just for stroke prevention in AFib.
Got it. So it's more about preventing bleeding than, actual stroke prevention with the antiplatelets.
Exactly. For patients with chronic coronary artery disease who also have AFib, the guidelines now recommend stopping aspirin and using just one blood thinner like rivaroxaban. A study called the AFIRE study found that using rivaroxaban alone worked better than combining it with aspirin. It not only prevented serious problems like stroke, heart attack, or even death, but also reduced the risk of dangerous bleeding. So it's safer and just as effective, maybe even better, for protecting these patients.
That makes total sense. So it sounds like rhythm control is pretty important for managing AFib, right?
Absolutely. It's like one of the key pillars of AFib management, according to these guidelines. The goal is to keep the heart in normal sinus rhythm as much as possible. Because, as we discussed earlier, AFib tends to progress and become more sustained over time, right? And that's associated with worse outcomes. So by maintaining sinus rhythm, you're not just treating the current symptoms, you're also trying to prevent the disease from getting worse. There's some promising evidence that rhythm control can even reduce the risk of developing dementia and heart failure, though more research is needed there.
Oh, wow, that's really promising.
Yes, it is. And you know what else? Early rhythm control might actually reduce hospitalizations, strokes, and even deaths. The East AFNet 4 trial, that was a large study, found that rhythm control in patients with new onset AFib resulted in fewer of those really serious events. So the earlier you start managing it, the better.
So for someone newly diagnosed with AFib, what would be the next steps? Like, what kind of evaluation would they need?
So, for someone newly diagnosed with AFib, the first step is a thorough evaluation to understand the underlying causes and overall risk. This involves reviewing their medical history, conducting a physical exam, and performing tests like an EKG or echocardiogram to assess heart rhythm and structure. Blood tests are also important to rule out factors like thyroid disorders or other conditions that might contribute to AFib. Once we've completed the evaluation, we create a treatment plan tailored to the patient. If medications don't work or cause troublesome side effects, one of the most effective options for rhythm control is catheter ablation. It's become a standard therapy, especially for patients with symptomatic or persistent AFib. Thanks to a number of studies and large patient registries, it's a really good option, especially when medications aren't working or causing nasty side effects.
How does catheter ablation work exactly? Like, What do they actually do during the procedure?
Okay, so basically, they insert catheters into the heart, usually through a vein in the groin, and use radiofrequency energy or sometimes cryoablation, that's like freezing, to create small scars in the heart tissue. These scars block the faulty electrical signals that are causing the AFib. The most common type of ablation is pulmonary vein isolation, or PVI. That's where they isolate the pulmonary veins, which are often the source of the abnormal electrical signals.
So it's like they're cutting off the source of the problem, right?
Yes, exactly. And it's super effective. Multiple studies have shown, that PVI is more effective than medications for reducing AFib burden. Take the Cabana trial, for example. They found that catheter ablation with PVI reduced AFib recurrence by almost 50% compared to medications. It's a really impressive result.
Wow, that's a huge difference. So is catheter ablation a good option for everyone with AFib? Or are there certain people who are better candidates?
Well, yeah, patient selection is super important. Generally, younger patients, those under 70, tend to have better long-term outcomes. But you know what? Studies have shown that even older folks in their 70s can also benefit, especially if they have symptomatic AFib, like, that's causing them bothersome symptoms. Also, patients with smaller left atria, fewer comorbidities, and paroxysmal AFib, that's AFib that comes and goes, tend to do better, but we can use ablation in patients with persistent AFib too. It's just like more effective in those with, relatively recent onset persistent AFib that's under a year. There are some situations, though, where ablation might not be the best choice. For example, if someone has severe mitral stenosis or regurgitation or another condition that makes it hard to maintain sinus rhythm.
Right. And what about risks? Like, are there any potential complications with catheter ablation?
So, yeah, there are some potential risks, like with any procedure. The most common complications are vascular. That's like bleeding or bruising at the catheter insertion site. But they're usually minor and easily managed. More serious complications, like cardiac perforation, stroke, or, atrioesophageal fistula, are rare. They occur in less than 1% of patients, but they can be life-threatening. So it's like really important to talk to your doctor about the risks and benefits before making a decision.
Absolutely. And if you experience any chest pain, pain with swallowing, fever, stroke symptoms after the procedure, you should immediately seek medical care.
That's right. You should definitely seek immediate medical care if you experience any of those symptoms. And another thing to consider is that up to half of patients may need repeat ablation procedures to, achieve long-term rhythm control.
Okay, so it's not always a one and done kind of thing.
Yeah, it's a journey, but even with repeat procedures, it's often very successful at improving symptoms and quality of life.
That's really good to know.
So, listeners, that about wraps up our discussion on the latest guidelines for managing AFib. I hope you found this deep dive really helpful.
I know I did, Dr. Reddy. Thanks for breaking it down for us. It's so much to take in, but you really made it clear and easy to understand.
Of course. Happy to do it, Anna. It's so important for people to be informed about their health, especially when it comes to something as serious as AFib.
Absolutely. So, what are the key takeaways from today's episode, Dr. Reddy?
Okay, so first things first. Lifestyle changes are absolutely essential. Regular exercise, cutting back on alcohol, quitting smoking, all of that really makes a difference. And if you're overweight, aim for at least a 10% weight loss. That can have a huge impact on your AFib. Next up, stroke prevention. If you're at risk for stroke, talk to your doctor about anticoagulants like warfarin. The right medication is crucial. And don't forget about rhythm control. It's often the best strategy for preventing AFib progression and improving long-term outcomes. Catheter ablation can be really effective, especially for those folks with symptomatic AFib or heart failure.
Totally. Early diagnosis and treatment of AFib is so important. And this updated guideline really does a good job of outlining the best strategies for managing it.
It really does. And don't forget to consider non-pharmacological interventions like the Watchman device if you can't tolerate anticoagulation therapy.
Right. it's not a one-size-fits-all approach, you know? It's really important to work with your doctor to find the treatment plan that's right for you.
Absolutely. It's a journey. We're all on a journey to better health.
So, listeners, before we wrap up, please remember to consult your healthcare provider for any medical concerns. This podcast is for informational purposes only and, isn't a substitute for professional medical advice.
That's right. Talk to your doctor. They can help you understand the best course of treatment for your individual situation. And one more thing. Before you go, please take a moment to subscribe to our podcast so you'll get notified of new episodes, gain access to exclusive content, and join a community that's making positive changes, one story at a time. And share your favorite episodes with your friends. Spread the knowledge.
We love hearing from you, so please leave us a review and let us know what you think of the podcast. We'll be right back for another fascinating medical story. Until then, stay healthy and curious.
Take care, everyone.